Welcome to Helpline Extra, where we take a deeper dive into the topics we see all the time on our regular Helpline program. I'm joined by Chris Minogue, our expert and Mothercraft nurse. She's had over 30 years experience helping families with all kinds of topics, so she knows what she's talking about. But before we start this deep dive, I just want to preface this advice by saying it's not intended to take the place of specialist medical advice. If you have any concerns about your child or baby, make sure you go and see your GP. Chris, our topic for today is how do you stop a toddler from smacking? Why does a toddler normally act out in a physical way?
It's usually the result of the tantrum. So they're usually in a tantrum, they're tired, they're moved too quickly, so that what they call the transition was too fast for them. So I was playing nicely in the park and my mum comes along and says, we're going home now, they'll lash out. But the bulk of tantrums where they're physical comes from a place of frustration and tiredness.
Okay, so how do we prevent that from happening in the, apart
generally,
from naps,
So to prevent it, we need to realise where that child's at. So if we're in the park and we're playing and they're beautifully playing with their friends, then we give warnings. So we might say to a 2-year-old, in 5 minutes, we're going to go home now. In 2 minutes, I need you to put your shoes on. So what we're trying to do is help them through that transition to avoid tantrums just in general. But you can imagine a long day of daycare and you pick them up and you're trying to get them in the car and then trying to get them home and trying to get them in the bath, that it's just too quick. They're already tired, and so what they do is they lash out through the frustration and the tiredness that they're in.
Right, so it's all well and good if we can be aware of that.
Yeah.
What do we do when they're at that point of lashing out?
Yeah.
How do we respond as their parents?
So we have to remember that we're the adult and they're the child, and we know where it's coming from. So with the older, say 2 or 3-year-old that might exhibit that behaviour, I'd probably get down on their level and say we do not hit, because what I'm telling them is this isn't the behaviour that we use. But we also know that we have to be mindful of where they're at. So we do not hit, but maybe myself, I have to slow this down, give you more time, understand that you need more time, you want to play in the bath before you get out of the bath. They'll either hit, kick or bite. So if I know that they're a biter, I wouldn't necessarily go and put my hand down because they might bite me.
Yeah.
So I might go at it a different way. So maybe get them to come to you, maybe move them from behind. The same with the hitting. The hitting often happens where the child might be having a tantrum, you've taken something away from them that they don't, or they want, but you don't want them to have. You go to pick them up and they just lash out with their hand and hit you. And that really shocks the parents because 1, it has a lot of force behind it and it hurts. But 2, they don't think their child would be that hitter, kicker or biter. And so I think you have to remember that if your child is that child and you remember that they're that child, you have to go at it a different way. So if I want to move a child quickly and I know they're a hitter, I go from behind and pick them up and move them that way. And then I'm less in the place where I'm going to be hit or I'm going to be kicked. But it is a very difficult thing because I don't think there's parents out there that think their children are going to act this way. But in actual fact, it's a really normal part of development. Not that normal in that all children will hit and kick, but it's a normal reaction in a toddler when they're tired and they're frustrated.
Okay. Is it possible to teach a child of that age, quite young, other ways of dealing with that frustration they feel?
Probably not in the very, very young child. So you can see tantrums in children probably from 12 months on. I mean, real tantrums in children. But I think when they're getting their speech development is increasing, so in that 2 to 3, and certainly closer to the 3-year-old, I think you can use words to help them to tell you how they feel. So if a child is getting very frustrated and they're in around the age of 3, we can sit down quietly with them. But it is about the act of slowing them down and say to them, how do you feel? And mummy had to take that away from you because ABC. So we need to use that type of language, but commonly you can't use it until they have that understanding in or around 2.5 to 3 where it's effective. So you can say to a 2-year-old, Mummy needed to take the knife off you because that's very dangerous.
Yes.
But the 2-year-old go, okay, and then go and find another knife. But a 3-year-old really understands that danger and it needs to be taken away from them.
Okay.
So I think you need to use age-appropriate language to help them through. And in different ages and stages, it'll be a different type of conversation.
So when they're very small, we kind of just need to accept that it's something they'll probably grow out of.
We have to get them to wait, let them have the tantrum and then distract them and move them on. And ineffectively, we do that with a 3-year-old, but we can have more discussion around that behaviour. But I think as parents, we need to understand where that child's at when we're asking them to do something. So for instance, taking them shopping at 5 o'clock in the afternoon, you will have a tantrum. So sometimes we inadvertently put a child in that position without even thinking. And then when the explosion happens and the tantrum, the hitting, the kicking and the biting, we wonder where it came from. But actually at 5 o'clock in the afternoon, they can't tolerate some of the things that we expect them to do.
Right. Well, Chris, thank you so much for your advice
Oh,
today.
it's a pleasure.
I'm Shevonne Hunt. Thank you so much for your time today. See you next time.